All right. Well, good evening, everyone. Welcome to MGO Live. MGO Live is a live stream interactive panel discussion on relevant topics related to Orthodox faith. It's hosted by the MGOCSM of the Northeast American Diocese, and it's open to all age groups and all life groups. This has been going on for quite some time now. We've been delving into different topics related to faith, related to mental health, and different relatable topics that are related to our people, our young people, as well as our focus age, and basically all the different life groups within the life of our church. Today, we're blessed with the presence of two individuals. The first person is Dr. Joshi John. He is a member of St. Thomas Orthodox Church in Long Island. He is a psychiatrist practicing in the field for over 25 years. He is the former director of psychiatry at Northwell Health System in Syosset, New York, as well as at Plainview in New York as well. And he is now in private practice, continuing to be a psychiatrist. We're blessed with your presence. Joshi, thank you for being with us today. And we're also blessed with the presence of Ms. Varsha Varghese. She is originally from Toronto, and currently resides in Detroit, Michigan, with her husband, son, and her dog. She received her master's in counseling from the University of Detroit Mercy, and currently she works at a maternal mental health clinic, helping women overcome postpartum depression, anxiety, trauma-related issues. She's been training and helping individuals overcome childhood trauma, domestic violence, abuse, depression, anxiety, and self-esteem issues. Varsha, we're so blessed to have you today. Welcome to MGO Live. Before we begin, we'll begin with prayer, and then we'll hand it over to Joshi and Varsha. So let's begin with prayer. Barak O Heavenly King, the Comforter, the Spirit of Truth, who art everywhere present and fillest all things, treasury of blessings and giver of life, come and abide in us and cleanse us from every impurity, and save our souls, O good one. Amen. All right, once again, welcome to MGO Live. You can submit your questions that you may have via the link, which is posted in this YouTube description, bit.ly/MGOLiveQ. So you can submit your questions there, and then the speakers will try their best to address those questions throughout this session. And without further ado, I'll hand it over to our speakers for today. Thank you for being with us.
I guess I'll start.
I'm just going to share a screen.
Yeah. Nice.
There you go.
All right. All right. Well, welcome everybody. First of all, I want to thank the MGO Live committee for inviting us to talk about this very kind of important topic. And I think we both are going to try to give you a little bit of information, but also we want to answer your questions if you guys write in, and see what we can do to help. And I guess the most important thing is, why are we even talking about this? Why are we talking about mental health? Like, what's the big deal? Well, clearly, that, you hear it in the news, you hear it at school, you hear it, at work, you hear it everywhere. People are talking about mental health. Mental health is sort of a big thing now, but we don't really know, we really need to know what mental health is. And I think I come from a sort of a unique perspective that my family came here in the late 1960s. So we've seen the Malayali community and our Orthodox Church grow in leaps and bounds. And I've also seen the evolution of, certain issues that can affect us. And I think, in terms of mental health, I'm going to be talking a little bit about that. So we're going to cover a little bit of everything. And so what's the significance of all of this? And I said, I had this unique perspective that, once upon a time when our church was very young and we had very few people, and we had the first people who came to this country, and, they were kind of pioneers, and they had to work real hard, and they didn't know how to do a whole lot of things. They were learning on the go, learning how to buy a house and how to get a job, and how to use the subway, or things like that. And back then, mental health was not something you really talked about. It was one of those things that was just sort of in the background. So when you had a problem and you talk to your parents, perhaps, or an elder person, they'll just say, just tough it out. Just don't, we have bigger things to, just study harder. You gotta get better. Because that wasn't, I mean, that's how they dealt with it, and there are reasons for that. But and you didn't really even hear it in the general population. Like you didn't really hear it about on the news, and people didn't really use the words mental health or mental issues, or really didn't talk about things related to that. So the topic's really important because now it's very different. Now you hear it all the time. But we have to understand, we have to ask ourselves, what does it mean? And what does it mean to us in our community, in our church community? Because that has its own unique sets of variables that we need to negotiate. So I do want to say, though, I think probably the reason we're talking about it even today is that, first of all, compared to before, we're talking about it. And people never talked about it before. So and like I said, as I said before, you hear about it all the time. You hear it from on the news. You hear it everywhere you go, and we see it a lot more, and we see the effect of things that happen in mental health. And I keep saying the word mental health, and some of you might be like, well, what does that exactly mean? So we're going to talk a little bit about that as well. So we're going to definitely get to that. So if you're confused about that, don't be. We're definitely going to address that. So why is it important in our community or in our world? Why is it important to even address these issues? Well, mental health issues affect not only individuals, who suffer from it, but also those individuals affect families, and those families affect communities. And once upon a time, people used to think it was somebody else's problem. But we're finding more and more in our community, and especially in our church community, it's being addressed because sometimes those issues affect the whole community. And I'll give you an example. Perhaps somebody has a serious mental illness, and because of our cultural values and whatever else, we don't really address it, but they get worse, and now it affects the family of that person. But let's say it takes it to a whole nother level, and say perhaps that person commits suicide. Now it affects the whole community. And I'm not just talking, imaginary examples. We've actually had situations like that. So it's a very serious situation. So we definitely have to know something more about it than what we think we know. Just to give you some general statistics to show you how important it is. And these are not even very new statistics. These are maybe a couple of years old. 1 in 5 adults commit suicide, about 22%. Almost 50% of adults have some kind of mental illness, and about 5.5% have very serious mental illness. 50% of adolescents have some sort of mental illness. Suicide is the 11th major cause of death, and it actually surpasses cancer and heart disease. That's pretty crazy. It's the second highest cause of death in ages 10 to 14, third highest cause of death in ages 15 to 24, and fourth cause of death in the ages of 35 to 44 age group. About $1 trillion a year in the United States is lost due to mental health issues, lost work, lost days at work, that kind of thing. And they even estimate in the world about 12 million working days are lost because of mental health issues. So this is, and then we're not even counting, those who are not working. Those are say you're in school, and how many days of productivity you lose by losing school or things like that. And of course, not to mention quality of life, which is probably the most important. So these are really kind of scary statistics. Certainly when I was growing up, we didn't have these kind of numbers, that's for sure. But don't lose hope. Don't lose hope. And I'll tell you why. Mental health is nothing new. I mean, yes, it's getting a lot of attention now, but it's nothing new. If you go back to the Bible, there are characters in the Bible, I mean, biblical figures who have had issues with mental health. And the interesting thing about that, and I'm going to say it first, is that yes, they had some issues. I'm going to point some of them out, but they also overcame them. And I think that's an important thing. And we'll talk about that, hopefully a little bit later. For instance, Elijah, the prophet Elijah, he was very scared because his life was being threatened, and everybody wanted to kill him, and so he was hiding out, and he was depressed, he was hopeless, he didn't want to live. He wasn't eating and sleeping, for a while, but eventually God helped him, and he was faithful and he did his bidding. Same thing, King David, who was very sad and depressed for a variety of reasons. If anybody who reads the Psalms, a lot of the Psalms start off with a lot of sad things, happening. And then towards the end of the Psalm, he talks about the hope, and that's where it's almost because he was always faithful to God. Think of Martha in the New Testament. She was a very anxious person. If you remember the story, Jesus was preaching and everybody's listening, and she's busy in the kitchen and trying to get everything and running around frantic and worrying that people are not going to, be taken care of. If she was a patient in my office, I might say that she either has obsessive compulsive disorder or maybe generalized anxiety disorder. So, she definitely had something. Hannah in the Old Testament, who was the second wife. It was one of the wives of her husband, who the other wife had kids and she didn't, and she was mocked and she was emotionally abused, and she was also very, very depressed, and she didn't eat, and she used to almost feel like she was going out of her mind until God helped her out. And for more of that, you can read the Bible. Job, the story of Job. He lost everything. He was hopeless. He was depressed. He even asked God to take his life. But in the end, he also trusted God, and he came through it. And last of all, I think about Moses. Moses, he was told to go to Egypt, and he told God, "Well, I'm kind of scared to talk," and he had some performance anxiety, and God deferred. He made his brother Aaron be the speaker for him, but he had a lot of issues with that. And later on, when they were wandering in the desert, he had a lot of anger issues, and he also had to deal with that. But in the end, all of these people, and there's other biblical characters in the Bible that you can talk about. All of these other ones, all of them eventually, because they trusted in God, they came through. The only one who didn't was, if you think about Judas, who was going crazy at the end, but he didn't turn back to Jesus. He didn't turn back to God. He just took his own life. So, I'm just saying that there is hope out there, and we're going to talk a little bit about that too. So, anyway, so going back to some of the attitudes of the church in America, before and now, and I think this is something that as I said, I have a unique perspective on this. I think some of the reasons that there's a stigma in our culture. Hopefully it's a little bit less than it used to be, but still there is, that a lot of people in the first generation, they never had time to think about these things. They had too many other problems. So as I said before, their kind of mentality was just tough it out and get through it. This is not important. Clearly now it is important. I think a lot of that was because that generation lacked a lot of the mental health words. They didn't know how to express themselves. They didn't know what this was. This was not something they really had experience with in their lives. The early church was also struggling. A lot of churches, if any of you are old enough to remember, were sometimes in basements or other places, and they had to expand, and they had to grow, and over the years, and when there was difficulties in the church and there was fights, and this really wasn't a good environment to kind of like then say, hey, I'm having a problem. What do I do? Because again, the focus was on something else. Now that's all about the past. I think the present, we've come a long way. Clearly, maybe not enough, but we definitely come a long way. I think the church has kind of stabilized for the most part in terms of its structure. And I think clergy is much more attuned to mental illness, as all of us are, because we are bombarded with it by the media and by, you know, other things that are going on in the world. So we are much more aware of issues that maybe were not important or were not even understood back in the day. So that's a good thing. And but we still have some, you know, we still have some issues, and there are some things in our community that we definitely want to address. And I'm going to give it over to my co-host here to talk a little bit about some of the mental health needs in our community, because they are very important.
Yeah, so the mental health needs in our community. To understand that, I think we need to understand the complexity of the identities that we hold as Malayali Orthodox Christians living in North America, right? So a lot of the times, you know, we're a minority, but a minority within a minority, where if we are surrounded by people of color, how much of the people we are around are brown people, and how many of those brown people are South Indian, right? We hold a very unique niche experience being from Kerala, being Malayalis, and our cultural identity is very different. And then you add on top of that, that yes, we're a minority, but we're Christian, right? So now we're sort of a part of a majority in North America in some senses. But we're not just Christian, we're Orthodox Christian, and that adds another layer of our experience. And so, you know, we have a hard time trying to fit all these parts of our identity together. And what comes with that identity, I mean, as Dr. Joshi talked about, like our parents, if you are first generation, right? If your parents immigrated here, their experience was survival, right? We're just trying to live, food, work. That's the needs that they have met. But when you are a child of an immigrant parent, or you yourself immigrated here when you were very young, how do you stick to your roots, right, of being a Malayali person while also holding true to your Orthodox Christian values, while also assimilating to this American culture? And a lot of us really struggle with keeping all parts of these identities together, and it causes this dissonance, right? And that can really open up things to anxiety and depression. It makes it hard for us to connect socially. Our parents probably struggled with how to keep us to our roots, their cultures and the values and the morals that come with that, while also not allowing us to alienate ourselves in this community. And so I think it's important to understand our identity from the beginning onwards, because it's going to help us have those conversations with our parents and with our loved ones about mental health, because we need to understand each other's experience being here in North America and how our identities add to that experience in order to change the conversation. And so being here in North America as children of immigrants, or being immigrants, we feel like an immense sense of pressure to succeed. And I don't know if a lot of parents quite understand the level of pressure that first generation kids experience, because they understand that their parents made a sacrifice, and they understand that their parents left everything to come here to create a new life. And so they feel an immense sense of pressure to succeed, to have these high powered jobs, if you will, or whatever success looks like to them. And that can cause, you know, that can open up a lot of mental health issues. They're also comparing themselves to other people in their community. So there's internal competition. There's a lot of belonging that we feel in our churches, right? Because everyone shares a similar identity to us. We're all Malayali, we're all Orthodox, we're all Christian. Our parents all have the same story. So now the playing field is leveled. They have no excuse not to succeed. And so now we're comparing ourselves to each other. We also are trying to understand, how do we put our American values along with our Indian values, or Malayali Christian Orthodox values. So things like social justice issues, our kids really struggle with navigating things like LGBTQIA+ issues. What is our church's stance on that? If my friends are talking about it, or if I have friends who identify that way, how do I fit into this conversation? A lot of times in our community now, when we say we are Christian, there's already a stigma against us because people assume what our mentality is towards different groups of people, right? And Christianity has gotten a bad name in some senses. But at the same time, we are also a minority in this country. So we have been marginalized in many ways and face discrimination in other ways. And so our kids just they can really struggle with all of these conflicts that happen. And at the same time, we also don't completely understand how mental health fits into our faith or into our culture. And I think it's important to separate faith and culture from each other and understanding that in our culture, there may not have been a place for mental health needs or understanding mental health in a way that was helpful. There's a lot of stigma in our culture. But in fact, our Orthodox faith, our religion, does not deter us from seeking mental health needs or professional help. Those are not mutually exclusive. It's not, I am an Orthodox Christian or I can have mental health issues. It's, I am an Orthodox Christian that has mental health issues, and my church actually encourages me to learn about my mental health and seek out that help. And there are actually many things within our faith that prescribe us to take care of our mental health. And as Dr. Joshi talked about, there are biblical figures, right, that can be examples of that and the hope that there is. So it's important to understand the struggle that parents had coming here as first generation or as immigrant parents, understand the struggle that our first and second generation kids have, empathizing with each other on the struggles that each person holds, and understanding that our faith does not exclude us from addressing our mental health needs and trying to help each other. And in fact, changing the discussion and changing the culture of our community to now be more encompassing and willing to meet those mental health needs, because that is going to help this next generation, really tackle all of the issues that they may face navigating this world. And so that's going to be very important for us to understand. And so what is mental health?
Yeah, that's a good question. A good question. Yeah. And by the way, what you just said, I just want to highlight that's, yeah, you kind of put it very succinctly. I mean, it's, I think we have to understand where the first generation came, but then we also have to understand where the second generation is and the third generation, where everybody's going. So, it's good to recognize, where we're from, but we also have to know where we're going. So thank you for that. But yeah, we keep saying, we've said the word mental health like 100 times now in this conversation, but we have to understand, well, we have to define what it is. I mean, what is it, Some define mental health as a state of well-being, including emotional, psychological, and social well-being. And it's how you feel and how you act and how you handle stress and how you relate to others and your ability to make decisions. So it encompasses a lot of these things. And that's the general term. And then it gets a lot more specific after that. I think in a lot of talks like this and other things, when we talk about mental health, or even when they talk on TV, a lot of it, people kind of assume it's depression or anxiety. And for the most part, it probably is. But it's just important to know that that mental health is a wide range of diseases and with a wide range of implications. Things that you've heard of, like ADHD, all the way to like geriatric diseases like dementia, OCD, bipolar, psychotic disorders, schizophrenia. All these kind of things are all under the umbrella of mental health. And yes, depression and anxiety are probably the biggest ones that we see, the most common that you see all around, but we shouldn't forget that, other people suffer from other things. You don't have to know what all of those things are, but just I think it's good to be aware that mental health means a lot more than just, one or two things. So how do you address, like how do we, when we talk about, these kind of issues, how do we, before addressing what to do about them, we have to understand that, when somebody says, like, for example, I'm depressed, well, what does that exactly mean? Because, there are degrees of severity. And with all of these, anxiety, depression, OCD, ADHD, there's different degrees, just like anything else. So if you were a heart patient and you had a little bit high blood pressure, but otherwise you were okay, your doctor might say, hey, you got to do certain things, change your lifestyle habits and all that stuff. And if you're, but if your blood pressure's sky high and, they do some blood tests and it's got all kinds of other stuff in it, they might say, hey, you might need an operation. So you can see that for the, just, like something like heart disease, it doesn't mean one thing, it means many things. Same thing with mental health. So for instance, again, depression, you can have mild depression, and that's treated very differently than somebody who has very severe depression. I'll talk a little bit about that right now. But mild in any case is usually, things that you can probably handle on your own or with a little bit of help or a little bit of advice. As you get into a little bit more serious things, you might need a little bit more structure where you might need a counselor or a little more support in your things. And then you have severe illnesses where, that are usually, a lot worse. In fact, mild illnesses are usually minor stressors. Something happens. I don't know. You failed your math test and you're upset about it, but you know what? You get over it in a couple of days. Or something, maybe you broke up with a short-term girlfriend kind of thing, and yeah, it hurts, but you know what? You eventually you get over it. It's okay. It's usually time limited. Moderate things are a little bit more than that. It's usually a little bit more, the stressor, the thing, the trigger is a little bit more serious. Usually the symptoms are going to be a little bit more, so whatever you have, your symptoms are going to be more prolonged for a longer period of time. The illness sometimes doesn't resolve very soon and may even start feeling like they're not getting better at all and sometimes get worse. And when it's severe, it's usually everything I just said, but way more, where you start having nothing's getting better. You're starting to have, you're starting to feel significantly hopeless that you're never going to get better. And then you start having some dangerous behaviors, which I'll be talking about at the end. But where it might affect you or it might affect people around you. So it's very important. So, and again, the reason I'm saying this is because, don't think if you have some issue, it doesn't mean, like in some cases, it doesn't mean it's the end of the world. And in other cases, it might mean that you need to really go get some help. So, and we're going to talk a little bit about how to figure that out during the course of the talk. And then important to remember that here's the other thing. A lot of people, some people, even today, believe that mental illness is just some kind of imaginary thing. It's just something that you make up and, oh, it's all in your head. Yeah, it is kind of, but science has shown us that that a lot of these things, even things like depression and anxiety, have a physical component. And if anybody looks in the mirror, you're going to see that this is connected to this. Your head is connected to the rest of your body. And we have something called the autonomic nervous system, which is a system in our body that was designed to help us in times of stress. Like, for instance, back in, a millennia ago, if you were walking in the forest and you saw a tiger, immediately your body, within two seconds, your blood pressure is up and everything's up, and you're all ready to go. And the reason that your body does that is so that you could either run away really fast or you could fight. And it's called a fight-flight response. If I can say that 10 times in a row, that'll be amazing. But anyway, it's one of those kind of things that that was designed to protect us. And the problem is that sometimes we have that same reflex, but not for seeing a tiger or some kind of danger, but just by thinking of something minor. And then we get all panicky. And sometimes people have something called a panic attack, and it's very scary. And the reason is because your mind sends a signal to your body that something's wrong, even if it isn't that bad. And your body overreacts to a point where it feels very, very bad. And I can tell you, one of the things that after treating so many people with panic attacks, when they start describing, I always finish their sentence. I said, yeah, and it feels like you're going to die, right? And they say, yeah, because it feels like you're going to die. They don't die, but it feels terrible. That's how bad it is. So, you get these kind of symptoms. So it's really important to know that this is not just some imaginary fairy tale thing. It's not just something that somebody just made up. There's some real things that happen in your body when you get stressed out. Or whether it's biological reasons, whether there's a trigger, whatever the reason is, there's a real effect. And I think you really need to keep that in mind. How do we know when to do what? So obviously, I can't talk about every single psychological issue because we'd be here for a week, maybe more. And so that's not possible. But I can tell you a couple of things. So remember that, as I said before, that there are different kinds of mental health. Different kinds of mental illness, and I gave all those examples before. Depending on what you have, and your treatment may be different. For some people, certain illnesses, just talking may be helpful, and doing things may be helpful. For some people, you need more than that. Some people need medication. Some people need, in severe cases, hospitalization. And how do we know that? I mean, how do we know when we need these? So there's different degrees of severity. And just to know that, again, mild, moderate, severe, as I said before, depending on what your severity is, that's going to determine what your treatment is. And I think it's important to recognize when you start having symptoms. And as a general rule, I think, like, if you're not feeling right and you're not quite sure what's going on, I like people to keep a journal or start documenting what's going on. Like, for instance, I was just sitting in my room and all of a sudden, my vision got blurry, or I started feeling all panicky, or I felt panicky every time I go to a certain place or something like. And you got to be specific, because it's important when you tell somebody well, you may not know what's going on, but if you have a record of what's been happening, it might be helpful to that person, to the healthcare practitioner or their counselor, to know exactly what's going on with you. So it also helps when you are able to, kind of verbalize it or document it for yourself, so hey, this is going on. You might even notice there's a pattern. Every morning, when I get on the bus to school, I get all panicky. And there may be a reason for that. That's to be determined later, but at least you'll recognize that. Another thing is, especially in this day and age with the internet and books and resources, I think it's good to educate yourself about general things like depression, anxiety. If you're not sure about something, I don't trust the internet as the absolute source, but just as a kind of general, like, if you have no clue, that may be a good place to start. But I would also talk to people, but just educate yourself about what's going on with you, because that might help also. It's also important to know when to seek help, and yeah, I mean, as I said, if you have a mild case of something, again, sometimes a self-help book might help, or a self-help course might help, or talking to somebody might help, or something like that. It was just mild. Sometimes just changing a lifestyle. Somebody feels mildly depressed, they're just not quite themselves. Hey, maybe they need to go out and walk a little bit more, or exercise a little bit more, or maybe got to change your diet a little bit, things like that. But when it gets a little bit more serious, you might want to, I think it's not, you might want to, when it starts getting serious and you recognize that you're just not right and things are not quite getting better, it's important to talk to somebody. It's important to talk to somebody. Who are you going to talk to? Well, that really depends on the situation, but if you trust your family, well, then maybe you got to start with them. You could talk to your friends. I don't always think that I'm not really sure if friends are always reliable. I mean, I know I have best friends too, but there's certain things that you just can't tell your friends, things that your family might understand better than your friends. But you can talk to other people, maybe talking to clergy, maybe talking to a counselor, guidance counselor, somebody when you start feeling bad, or even your general doctor. Hey, doc, I'm feeling run down, and this is what's been going on with me. And you show me a little journal of what's been going on. They might refer you to somebody, so that kind of thing. When Yeah, and of course in severe, and when I say severe cases, remember I said before, when you get to a point where it's very like, you're not getting better at all, nothing's working, you're feeling super hopeless, and you're thinking like, I don't even see where I'm going. You're hitting a brick wall. Um, you really have to be very vigilant and very careful. At that time, it's imperative that you talk to somebody. And you know what? Sometimes people think that, oh, if I talk to my family or my parents or somebody, they're not going to understand. Something in those kind of cases, you just should. And believe it or not, I've seen it many times where people thought, somebody's not going to understand, but they do. They do. And of course, if it gets really bad where, um, you know, when your friends are worried about you or your family's worried about you, they might need to get you help and serious help. I'm going to talk a little bit about that at the end, so I don't want to really go into that much. But it's important to seek help, just like anything else. If you had a stomach ache, if it's a mild stomach ache, maybe you just take a Tums. But if it's a severe stomach ache, you might want to go to the hospital because maybe this is not normal. So you got to think about mental health the same way you think about physical health. I'm gonna then I like to also talk. I mean, sorry, let me go back again. I think I covered everything for that. We're gonna talk about how to seek help, and I'm gonna flip it back over to Varsha to talk a little bit about how to seek help in these kind of situations.
Yeah, so as Dr. Joshi talked about, whenever you feel like something is a little off, it's important to talk to someone. And so just to give you some practical avenues to go about, you can go to your primary care physician and they should have a referral for you, either for a psychiatrist or a psychologist. That's usually who they have. But if you want to just talk to a therapist, so that would include a counselor like myself, a social worker, or a psychologist. There are a ton of online resources. The one that I feel most comfortable for giving out is Psychology Today. It's a website. You can go on there, you can put in your zip code and find a therapist that is in your area, and you can filter the search for your insurance. There's also an option called sliding scale. So there are some therapists, if you don't have an insurance, you can ask them to give you like a rate that works with you. And there are many therapists out there that will work with you financially so that you can consistently come. So know that that is an option out there if insurance is not quite working out that way. On Psychology Today, you can filter out for your insurance or how you want to pay. You can filter out for if you want a male or female therapist. Remember, this is like it can be a long-term relationship. So you want to find someone who you feel the most comfortable with. You can also filter out for areas of expertise. So are they, do they have training in spirituality? Do they have training in OCD or depression, anxiety? Whatever you feel like your history is, making sure they match that criteria. And in all honesty, sometimes it takes a little bit of trial and error to find a therapist that you feel comfortable with. But the advice that I can give is to trust the process and to trust the therapist as much as you can and go with your gut. If you feel good about how you are connecting with them and you feel like they are helping you, stick with it as much as you can. Therapy can be really tough sometimes, especially as you go along, but it's so beneficial. And it's sort of like a hill, right? You kind of hit a valley and it gets kind of tough, but you come out with a lot of revelations and understanding. As someone who has given therapy and been through therapy, I can say that on both ends, right? That it's very helpful as long as you're open and you stick with it. If you are a college student, you should have a counselor or a group of counselors that are on campus that is actually a part of the tuition that you pay. So you can seek that service out. If you go to student services, they should be able to redirect you, and that should be a free service that is there for you. And especially if you're going away to college, like it's right on campus, that is an option that you have. The Northeast American Diocese and Southwest Diocese have a department of counseling. Ligon Thomas Skuchema, she is in charge of the Northeast Diocese. And then if anyone wanted information on the Southwest Department of Counseling, you can contact me Father Samuel is in charge of that. So those are two resources that our church is developing right now to help educate on mental health services. So they are really great resources for you to seek out any information or help that you might need. They may not be able to provide like one-on-one counseling like you would be able to get if you found a therapist on Psychology Today or on campus, but they can give you some direction and some resources. And a lot of our churches, the MGOCSM has done campus ministry. So that is a way to connect with other Orthodox Christians on campus and to keep that a part of your wellness on campus while you're away from home, especially. So our church itself is really supportive of mental health services and providing that help and those resources. These are just like 4 practical ways that you can go about finding someone to talk to. As Dr. Joshi talked about, if you are having thoughts of self-harm or suicidal ideation, if you are at imminent risk of harming yourself, please call the National Suicide Hotline. It is very important that you call them, that you talk to them. We had a question come through to ask, if someone had suicidal ideations. If you have a therapist and those thoughts are there, please make your therapist aware of them. It is very important for us to assess your safety and your risk because your life is very important. And I'm sure Dr. Joshi has a ton of expertise on this area.
Actually, can I just say something about that?
Yeah.
Yeah, and exactly what you said. The hotline is great if you need that. Just as my own experience, because I used to work in emergency rooms, and the thing is though, if you have suicidal ideation, or your friend or relative is starting to talk like that, and you're really concerned, you can go to any emergency room because it's an emergency. If somebody's talking about taking their life or even hinting at it, even if you think it's just a cry for help, don't take that chance because you don't want to be that one statistic where you just didn't call their bluff and then it happened. So you can go to any emergency room, they will not refuse you, and you'll talk to somebody and they will get you the help. Sometimes it's nothing much, and they you go there, they'll assess you, and you may be able to go home with a referral. Or if it's that serious based on what they talk to you about, they might need to do something more and help you out with that. So the whole issue of suicide is extremely serious. So I'm going to talk. That's one of the things we're going to talk later. But since the question came up, I definitely advise everybody, do not play games when it comes to suicide. When it comes to either to yourself or somebody else. Just even if they threaten you and say, well, if you take me there, I'm never going to talk to you again. Well, better that they never talk to you again, even though they will, than for them to lose their life. Just go if you love them enough, you'll take them to the hospital or whatever emergency place. Okay, just want to put that out there.
Yeah. We're going to go into just how to have a conversation with your family and friends about mental health. So we talked a little bit about the 2 experiences, right? So if you have parents who are immigrants, why it may be hard for them to understand issues of mental health, and then for parents to understand what their kids might be experiencing. So if you are a child and you want to talk to your parents about it, inform them that you want to talk about it. So mom and dad, hey, I really need to talk to you about something. Please let me finish before you ask any questions. This is really hard for me to talk about. Be honest about that experience. Talk to them about what you have been experiencing. So, for example, if it is depression or anxiety, let's use that as an example. I've been having some anxiety. I've noticed my heart is racing. I get kind of nervous going into school, let's say. Talk about how it's affecting your life. So it makes me not want to go to school every day. I'm dreading each day, or I'm having a hard time waking up in the morning. Talking about how your mental health is affecting you is going to be very important for your parents to understand tangibly what the effect is here, right? That gives them like a problem, and sometimes they feel like they have to solve it. The thing is, our parents want to fix everything, right? They want to help you. That's their whole job. That's what they've been doing their whole life. Is you fell down, we get a Band-Aid. You're sick, we go to the doctor. Like there's always something you can do. Mental health doesn't quite work the same way. And so it's going to be important for you, if you can, to try to identify what kind of support you are seeking from your parents. Hey, I need help figuring out insurance so I can find a therapist. Maybe that's all you need from them. Hey, I need you to be understanding with me. This is why I've been acting a little differently. Like, please be understanding. That's all I'm asking from you. You can work with them and say, I don't quite know what I need from you. I just know that I need a little bit of help or I need some support. Um, and normalize the experience. If you've learned something from this presentation, right? Helping them understand that is quite common. It's prevalent. It affects, a lot of people at different stages of their life. It's nothing to maybe be alarmed about, because the first thing our parents want to do is, oh my God, like, what do I do? And they panic maybe because they may also have some anxiety as you being their child. And go in with the expectation that this might be a little scary for them as it is for you, and you guys want to learn to work on it together. And having that conversation is going to be important, because when you need to call someone or talk to someone when you aren't doing well, if you can trust your family and friends, it's going to be important for them to know where you're at and how to help you through those times. And going to therapy and seeing a doctor can help you understand how to better formulate like how people can help you. So those systems are going to work together. And so that's going to be important for anyone who is experiencing this, to be honest and open with family or friends. And not everyone might feel comfortable going to all family. That's not the situation that everyone has. Having a trusted adult, at least someone who can help you, talk you through it. And I say adult because, as Dr. Joshi said, like, your friends are going through maybe similar things. They might not have that experience or that maturity, if we want to state it that way. So having an adult, aunt, uncle, somebody that you really trust, to let them know, hey, this is what I'm going through and I might need some help, and this is what help looks like. The conversation is happening in our church. I've been lucky enough to do some of these talks. So people are talking about it, people are understanding it, people want to understand it. Go in with that openness and that understanding that, it's scary to talk about, but it's important to talk about and have someone there to support you.
Oh, I want to just add one more thing.
Yeah.
Me being a lot older than you and most of the folks here, I understand parents in the first generation. Remember, their idea of mental health is back in India in those days, people who went to see a psychiatrist were like when you go to the city and you see the homeless guy, who's like talking to himself and yelling and shouting and running around naked or something like that. That's what they think mental health is. They don't think it's any of the other stuff. So it's not that that's just what their experience is. So when you say stuff to them, they might get scared. You have to understand they might be thinking, "Oh my God, you're not crazy," because I've had patients come up to me and say, "Doc, the first thing they say is, Doc, I'm not crazy," and I say, "Well, I didn't say you're crazy because you're not. You have something else." And I think it's important that when you talk to them, be honest. Just be honest and say how much it's affecting you, and tell them what's affecting you. Just like Varsha said just now, you got to just, the honesty is really important, because they'll get that. Remember, they're going to be a little scared because, again, they have a different idea of what meant to you. Mental illness means you're talking to somebody. To them, it means you're locked up in a cell, tied up and stuff, and getting shot up with drugs, which is not the case. So it's important to like be sensitive to them, and also sometimes if you're lucky enough to have, I mean, I think a lot of parents, a lot of kids think that, oh, my parents aren't going to understand, but when you really are very honest and open with them, they do. But in those certain situations where maybe for whatever reason the parents may not be quite as, maybe there's an uncle, maybe there's an aunt, there's somebody who kind of like can help, kind of bridge the gap a little bit, maybe soften it up a little bit so that they can hear. And then, I think if you do these things, I think for the most part, you'll have some success. Yeah, that's it.
Sorry, I'm trying to unmute my mic.
No problem.
Actually, maybe we go into suicide now, because there's a couple of questions coming in
Okay.
About it. So our first question was, what resources are available for those who have suicide ideation or suicidal thoughts? And the second question is, if someone calls me saying that they are thinking about taking their life by suicide, what steps do you recommend that we take? Do you want to?
Well,
take
I kind of what I said before. The second question is definitely, If somebody's saying they're thinking about taking their life, you just drop the phone and go grab them and get them, and and call everybody. And if you're not nearby, you know, call whoever's there, call somebody in the house and say, go grab them, It sounds a little drastic, but again, I'd rather that you do a little overkill and make sure that they're safe than just kind of be like, they're just saying stuff, and then have a terrible event. So yeah, I think the more emergent the situation, the more action you need to take. So if they're just having like mild thoughts and stuff, they definitely got to see somebody, talk to somebody. But if they're definitely talking about like, I feel like taking my life today, you just, drop the phone, get them, grab them, put them in the car, get it to the emergency room. It's as simple as that. So, think about somebody having a heart attack. If they have, I don't know, my blood pressure's up, I get a little dizzy. Okay, maybe we should go see your doctor. Oh, today I feel like I'm having chest pain and my arms falling apart. I think I'm dying. You call 911. It's just like that. And actually you can call 911 for situations too. If you're calling somebody and they're saying they're about to do something, you don't even have to tell them. Just call 911 inside, get it, and then get over there. So, I know this sounds a little drastic, but drastic, situations require drastic measures. And if it's not as drastic, you still got to get some help and, definitely, or get support. Like another scenario might be, well, somebody's talking about this stuff. You're not sure if they're really going to do it, but then they shouldn't be alone. So maybe you got to get their family members or if if they're in college, get their friends to not let them be alone until you can get some help. So things like that, are things you can probably do.
I think it's also, if I could add, important to stay as calm as possible in that situation. The person that you are talking to is probably quite panicked and quite conflicted and may not be thinking as clearly as they want to because of how panicked that they are. Some of the things that you can do, if it's okay to assess sort of what they're thinking. What are you planning on doing? Do you have something there with you? Is there anyone that is nearby? Just like series of questions that you can ask. Can we call someone to come near you? As Dr. Joshi said, having someone nearby them so that they're not alone in that moment is going to be very important. If they are at home and their parents are home, like someone needs to call the parents to make sure that the parents can get to them. And that might feel like a violation of privacy or confidentiality or whatever it might be. But as Dr. Joshi said, their safety is most important. That life is very important. Even in that moment, if just to keep them on the phone, if you have called 911 to get help to them, if you're not able to physically get to them or you're waiting for someone to get to them, just keep them on the phone. That's going to be helpful. So talking to them about how they feel, where are they, letting them know that you value them, asking them, what happened, why do you feel this way, whatever you can do to keep them on the phone so that that they are conscious and alive and they are not going to actually do something in that moment until someone can physically get to them and ensure their safety. That's going to be very important. I want to empathize that responsibility is huge if you do get a call like that from a friend, but know that you are a trusted person. And although that responsibility is huge, we are very lucky that they called a trusted person. And so, as calm as you possibly can be in that situation, do that. And then you, as the person who is in that situation, please make sure you talk to someone, because that compassion fatigue, that stress, you need to be able to decompress from that. And so it's going to be important for you as the person who had to, take on that role, to be able to go and talk to someone and say, hey, I just had to support my friend through this. And it was quite shocking for me. So we want to take care of the people that are also taking care of the people, right? So just a couple of things that we can think about.
I'm going to add one more thing, just a personal experience or multiple personal experiences. I used to work inpatient as well as emergency room. And, like a lot of times, somebody starts telling a friend, a sister, brother, they're having these feelings, and then they call 911 or whatever, and then they get them, and then they get mad. Why did you call? And then they're mad at them and they don't want to talk I'm never talking to you again, all that stuff. And I think when you're going to get sometimes you're going to get that kind of resistance, and that's okay, because I'll tell you why. Because practically 99% of the time, 99.9% of the time, they're going to say that. And I've even seen the person, the first day of admission, they're in an inpatient unit and they're locked up and they're like, I'm so mad at so-and-so and I'm never going to speak to them again and blah, blah, blah. And then, it's a couple of days later, they're getting a little therapy, they're getting a little better. And they're like, after that, it's like, they, at the end of their admission, they're like, I'm so thankful they called. I wasn't thinking right at the time. So they're going to say hurtful things. Like if you call, I'm never going to speak to you again and all that. Most of the time that doesn't happen. But honestly, if you care about them, it doesn't really matter. You're saving their life, period. So I just wanted to add that. And I've seen it multiple times.
I think that answers, I think, the two questions. Hopefully, if anything else comes up, please send your questions. I think what we have left is medication and some mindful practices, if we can share.
We should probably just talk a little bit about how to speak to clergy real quick.
Oh, yes. Yeah.
Yeah. And it's funny because I was reading something and somewhere and somebody was asking like, oh, why do you always say speak to my spiritual advisor? Okay. Listen, you can speak to a lot of people, but I was thinking about what are some of the reasons that people don't speak to the clergy or their priest or their spiritual father. And there's a lot of misconceptions, and definitely I'm talking about things that I've heard over decades. Things like my priest will get mad at me if I say something like this. Maybe he's an older person or something like that. These are misconceptions. My priest is going to judge me. Oh, they're never going to look at me the same. My priest will tell somebody else, and God, tell other people. If I confess, I'm going to be in trouble. I'm going to get in trouble somehow. I'm ashamed of what I am or what I did. So, these are some kind of common misconceptions. And I just want to say that, first of all, priests are not allowed to do any of these things. They're not supposed to judge. They're not supposed to tell anybody else. In fact, if it's in a confession setting, they're bound by, not to tell anybody. And I've seen many priests, especially in the modern age, that more priests are more aware of mental health issues, so they want to help you. So they're going to do the best they can. But if they also, and I've heard this from many priests, that they said if they don't know what to do, they're not going to be Superman and try to be a hero and help you when they don't know what they're doing. They're going to refer you to some kind of help. And we talked about some of the resources earlier that even in our church that we have. So I think that's really good. So I just wanted to say, don't feel, it's kind of like what we talked about when speaking to your parents. You can speak to the clergy, you can talk to your priest and say, Achin, I need to, talk to you about something that's very important. Can we talk confidentially? And I don't know a priest who's not going to, agree to do that. And then, and hopefully it's somebody you trust anyway. And if that's, even if you don't, they're bound by, their rules. But even then, if it's somebody you trust, I think that's going to be helpful. And believe me, I think they're going to try to get you help. So just wanted to say a little word about that. And then we want to talk about...
Actually, on that note, we have
please.
A question about what are some things you recommend to clergy regarding dealing with parishioners with mental health issues? So on the flip side, right, if you are a clergy member who has parishioners who are struggling or are seeking counseling, the first thing I would recommend is just being honest with the limitations of your expertise. So if you're obviously trained in mental health, right, you have that background, but I think being honest about how much you can help them and what is a scope of practice that you may not be most comfortable with, and having those conversations about seeking mental health services and even normalizing it. So if it's someone who culturally feels like, oh, I don't need that, that's not for me, whatever examples you can give or however you can help them understand that this is important for them, to seek out that help, make it relatable to them. So like, as you would seek a doctor for help, right? Please seek a mental health therapist. And it doesn't have to be too serious, right? It can be relaxed. It's just chill. They're just going to go there and talk to them. If you can provide ways that our religion and our faith theologically supports mental health. Our clergy are so knowledgeable in that, especially nowadays when they're learning about it. They can understand religion separated from culture and debunking, what is a cultural value that they have a misconception on, and what is a religious value. If you are able to provide prayers or Bible passages, so today we're going to talk about the Jesus prayer. So meditations like that they can utilize, I think is going to be important. And then referring to the Department of Counseling that are within each diocese for any resources that might be helpful, like books, counseling resources, things like that. But also, if you are a clergy member, doing as much education as you possibly can. There are so many books out there that tie religion and mental health together nowadays that are written by pastors, that are written by priests, some of them rooted in orthodoxy, right? So if you can do your education, that is going to be so helpful in pushing this conversation in our community about the importance of mental health and changing those conversations. Also, your sermons, right, are so powerful and helpful. If there's a way to connect with the people and make those relatable in a way where they touch upon mental health and continue to break down that stigma, I think those are really important ways that the clergy can connect mental health to the church, because that is the benefit we have with our clergy member, is that they are that direct line, right? But they teach us so much about the church, and I think they can teach us about the human experience in that way as well.
Great.
And then medication.
Yeah, I'm going to talk briefly because I don't want to run out of time. So just one thing about medication, sometimes the misconception is if I start taking medicine, that means I'm crazy. That's a common thing I hear. Well, it's not. It's just like the heart example. If your doctor says your blood pressure's high and you got to take such and such medicine, you don't even think about it. Or you got a cold and your doctor says take this antibiotic, you don't go, well, I'm sorry, it's against my religion. Nobody says that. So there's no commandment about not taking medications. Again, medication should be something if it's appropriate. I mean, not everybody needs to be on medication, but maybe some people do. So that's just about that. Remember, the body is the temple of the spirit, and we need to take care of our bodies. And when we're getting healthy mentally also, and if we have to take medications and if that's what's going to help us to get there, then that's something that we should definitely consider. Just some other just serious issues. Just we kind of talked about this. So I'm just going to go over real fast. Like I said, if anybody notices red flags, what are red flags? Things like talking about suicide, giving away all your things, not functioning at all. Like, you're just you haven't eaten or slept in days, or you're just locked in your room, for a week, without doing anything. Things that would concern anybody. That's a red flag. You should definitely do something. And I have this thing that I say, if you see something, say something, and then do something. So for sure, if you notice something's not right, don't just sit on it. Just say something about it. And if that doesn't work, do something about it, and we talked about some of the things earlier. And hospitalizations, we don't really have time, and I just don't want people to be scared. Again, hospitalization is a last resort. It's like if you go to I don't know, you go to your doctor because you have a cold, he's not going to admit you to the ICU. He's going to give you something. But, let's say you go to the doctor and now, that infection is something really terrible and it's spreading and blah, 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 and you need all this, then he might do that. But of course, that's only for that situation, a serious situation. So the same thing, unless somebody is a real danger to themselves or others, they're not likely to go to the hospital. But, if they are, then maybe they should, because maybe that's where they can get the help that they need. So I just want to say that one thing about that. And I'm going to turn it back over to you because I think you have some kind of cool stuff to share with us.
Yeah. So we were going to do a breathing exercise, but we don't have a ton of time. So I do want to refer everyone to research square breathing. It's a meditation practice to help focus on your breathing. It's great if you are feeling like an anxiety attack coming on, feeling panicked, even just feeling distracted. It's a great even daily practice to help us just take better care of our mental well-being. One thing I really like telling our people about is the Jesus prayer, right? So it's Lord Jesus Christ, Son of God, have mercy on me, a sinner. And it's meant to be a meditative practice. If any of you have prayer ropes, the each bead is meant to be said with this prayer. And so the beads are a really great tactile way to pull our senses in, especially when we're feeling scattered, distracted. in our church, our service uses all five senses, right? And so in that same way, we can practice, it's meant because to keep us mindful, right? So even in our service, there is this push for mindfulness and being present and being intact with our senses. It's the same kind of practice we use with grounding and with anxiety. And so using that when you are feeling anxious, when you are just having a tough time, the Jesus prayer, using your prayer ropes is a great way to say the prayer out loud, to hear yourself hear it, to close your eyes, to stop in any like visual input if you need to. The tactile input is having the beads. And for some people, they like to use incense or a candle, something like that. It's a really great grounding experience. And it's a way for us to connect and be in prayer. And so that's just something I want everyone to take away. And then I have a really great book that I want to recommend. It's called Depression, Anxiety, and Other Things We Don't Want to Talk About. It's by Ryan Casey Walker. He's actually a pastor and a licensed psychotherapist. And so it ties in how people feel like religion or Christianity does not allow for mental health well-being, and actually ties the two in so beautifully. And then for our community that struggles with perfectionism, there's a book called The Gifts of Imperfection by Dr. Brene Brown. She's amazing. This book is a great read for everyone. It's a super easy read, very thin. It's great for our students who hold themselves to a lot of pressure, or our parents who feel like, they hold themselves to a lot of pressure. And the last book I want to recommend for any of our young parents out there is Parenting Towards the Kingdom. It is by an Orthodox psychiatrist or psychologist. And it does a great job of talking about Orthodox teaching and how we can incorporate it into raising kids in the church. And he talks about kids from toddlers to teenagers. So those are three really great resources. If anyone wants any other books, let me know. I love reading books about self-help. But those are some resources for everyone to take away.
I'm just going to add to what you said about just a comment about the square breathing. And some people do the Jesus prayer with breathing, where they inhale at one part
Yes.
and then exhale. So and I can tell you, breathing has been very effective for a lot of my patients over the years. And the Jesus prayer also is just absolutely wonderful. And actually, if you combine the two, for some people, it's really good. So I just wanted to say that.
Yeah, that's all we have.
Awesome. Well, thank you so much, Joshi and Varsha for offering your time, your insights, helping us understand a little bit more what mental health is, understanding sort of the cultural impacts of that, and also showing us resources and ways to sort of tackle a lot of these issues that come up when it comes to our mental health. And just want to offer my gratitude once again to both of you for your time. As everyone watching probably knows, this resource will continue to stay on the Northeast American Diocese YouTube page. So feel free to refer to it as you please. So that resource will continue to be there. Just to add on one thing about the Jesus prayer that was mentioned, as I just want to emphasize once again, as both of our speakers said, that the importance and how powerful the Jesus prayer is, especially in our tradition. There was a study in 1998 by a psychologist at Boston University, and there was a test that was done, a survey that was done, a study where the participants did the Jesus prayer 10 minutes each day for 30 days. And the results of that was very profound and very impactful from that study. So we also see, as we know, the Jesus prayer is meant to be prayed as a way to be in communion with God. But at the same time, this study does show that there are psychological impacts from this prayer. So we do see how connected the body, the soul, and the mind is when we understand the human person. So just want to emphasize the importance and how powerful the Jesus prayer is, especially in our tradition. But once again, thank you so much, Joshi and Varsha. Both of these speakers today are resources and assets to our church here in North America. So I highly recommend you utilize these resources that are here. I'm sure they would be more than willing to address any questions that you may have regarding mental health, or if you need emotional support in your life. I'm sure they're more than welcome. They're more than happy to do that for you. So please remember them in your prayers. Remember their ministries in your prayers. And please continue to uphold this ministry of MGO Live in your prayers. As you all know, there are upcoming MGO Lives coming up. Next month, we will have missions and evangelism being led by Pradeep Jamajan, as well as Hattrick Episcopa from Washington. So they will be doing that next month. And then in September, we also have MGO Live, where we talk about anxiety and anger, being led by Reverend Father Ebby George, who's a vicar of St. Thomas Orthodox Church, Long Island, as well as Miss Susan Sanders. So they will be leading that in September. Once again, thank you to everyone who joined. We will close off in prayer. Father, more it is truly meet to bless thee, O Theotokos, ever blessed and most pure, and the mother of our God, more honorable than the cherubim, and more glorious beyond compare than the seraphim. Without corruption, thou givest birth to God the Word. True Theotokos, we magnify thee. Amen. Thank you everyone once again. Have a good night. Take care.